All right, so 7 questions about myself and my profession. So, what do you want to know? Okay, so 7 questions and answers. What is my name? Is that is that question number one? What's my name? Okay, no, it's not. All right, so my name is Allick Delancy. Question number one: what is my profession? So I am a psychologist, and I work in the area of education and mental health and behavioral work. So that's my areas of focus. So question number two, degrees and certificates and certifications. Okay, so I have a Bachelor of Science in Behavioral Sciences, and I have emphasis in psychology and sociology. And I also have a Masters of Arts degree in Educational Psychology. Both degrees they are from Andrews University, and for the master's degree, the emphasis is in learning, testing, research, and development. I also have a few other certifications and certificates that I will have collected along the way over the course of the years. So, question number three: what do you like? What do you like most about your career? Okay, so I have the opportunity to lecture, so I like that. I also do therapy and counseling. I like that as well. And I also like reading research papers. I don't read research papers every single day, but I read them regularly. And I like to learn about new behavioral techniques and strategies and what's going on in education and what's going on in psychology generally. So also too I like making videos like these, so I guess that's also what I like about my career. So question number four: how long have I been in this field? Okay, so I started off working with youths in 2005. So 2005, but I became a psychologist in 2010. So from 2005 to now 2023, well, you could probably do the maths. So we're looking at the fifth question. What are qualities to be a good psychologist? Well, there are probably many qualities that a good psychologist should possess. However, I think patience with yourself, patience when working with clients, not trying to push the client too quickly, but also not holding them back, obviously. Not being overly frustrated with yourself and not really um, taking time off to really reflect. I think that is a quality that could be very um, terrible to have, but taking time off to reflect and to think about how quickly you are absorbing the information that the client is giving to you, and thinking about how quickly the client is absorbing information, being patient with the process, with the therapeutic modalities. Those are, I think, some good qualities to have patience and patience around those different areas. Also, to listening skills. I think listening is really important as a counselor, therapist, psychologist. You definitely need to listen to the client. Also, be good at communicating. So writing, communication, speaking, communication, but also being aware of body language, being aware of your own personal body language as a therapist or psychologist, right? I think those are some really good qualities that a psychologist or someone working in the field of mental health should have. Being aware of themselves and being aware of the other individual that is before them, or the group that they are working with. So, question number six: what are your typical clients like? Okay, so I will answer this question from the standpoint of the type of clients I generally will work with. So I will work with clients who show traits associated with OCDs, ADHD, autism, depression, trauma-related issues, stress. Um, those are generally the clients I will work with, or the clients that I generally will see on a regular basis. So question number 7, most memorable case. All right, so I have many most memorable. Okay, I'll give you two. I'll give you two. So one, it was with a 7-year-old girl. I was working with her. We used a lot of play therapy with her. So I'm working with her. After about, let's say, maybe 3 sessions or so, she was leaving. So I'm seeing her and her mother out, and she turns around and opens her hands and runs towards me. Now she's short. At the time she was short, and she like running to give me a hug. So I kind of slant my body and kind of hug her a little bit. And the mother looked at me surprised. So I looked at the mother. It's like, okay, well, basically communicating why are you so surprised. And she said to me that my daughter doesn't hug or touch anybody. She keeps to herself. But for some reason she feels comfortable with you. So I was like, okay, that was good to hear. So that was a memorable experience. Another one was with an adult client, and when she came to me, she was going through some real difficult times, stress related, some depression, some levels of anxiety as well. And we created a behavioral plan after doing a functional behavioral analysis for we created a plan. So after creating this plan for her, we set some goals. And what was interesting is that she started to hit milestones or goals way before we even thought it would have been possible for her to do such. And when doing the evaluation, it was like, you're doing pretty good quickly. How is that possible? And she says to me, she says, well, I'm getting the support from you, and I'm seeing the need to change. And I think it was a good behavioral plan that we put in place to modify my behavior. So she was just hitting milestones and goals that we probably had planned for way down the road. She was doing it earlier. So that was good. So that was a case I remembered. A matter of fact, I think she probably just did about, it was less than 10 sessions, and she had already started making significant progress in her life, in her daily functioning. So 7 things about me and my profession as a psychologist. So I hope that this was motivating, inspiring. Possibly some of you might be thinking about going into the field of psychology, or maybe counseling, or doing some mental health work, or possibly you might be going into medicine, psychiatry. So if this was informative, I hope you all the best. You can like, you can subscribe, and hope to answer some more questions in the future. Take care.